So for more, let's bring in CBS News medical correspondent Dr. Céline Gounder. She's also editor-at-large for public health at KFF Health News. So doctor, remind us what hantavirus is and why it can be dangerous.
So people usually get hantavirus from rodents, as we heard, if they're cleaning up maybe rat droppings, mouse droppings in the garage or the basement. By doing so, you might be sweeping, vacuuming, you kick that up and aerosolize it into the air, and that's how you end up breathing it in. This is not usually something that is transmitted person to person, although this particular outbreak, we are concerned because the one situation in which there has been person-to-person transmission of hantavirus involves a form of hantavirus, the Andes virus, that is transmitted in Argentina and Chile. And remember, this ship was coming from Argentina. So one theory is that this just was being transmitted by rodents in their droppings or aerosolized urine. But another possibility is also person-to-person transmission.
What are the symptoms?
So as Tom was describing, people can develop lung failure, heart failure, kidney failure. A very severe viral pneumonia is very often how this manifests.
So people are watching, they might have a cruise coming up, and we live in a city where there are mice and rats everywhere. Are people who want to go on a cruise, or you and I, at risk for exposure to hantavirus?
Well, I want to emphasize, first of all, this is not going to be the next pandemic. I know a lot of people are still traumatized from the experience we went through with COVID. Even if it is the airborne form of this, the form that's transmitted person to person, it's not airborne in the way that COVID is. It really does require very prolonged, close contact with somebody else. We do recommend that people, if you are going to be cleaning up rat droppings or other kinds of things like that, that you use gloves, that you use a respirator, that you use watered down bleach so that you're not kicking it up into the air. But this is a geographically localized kind of infection. In the United States, we do see hantavirus. Fewer than 900 cases in the past 30 years, and largely localized in the Four Corners area.
Anything else you think we should take away from this?
Just be careful, when you're dealing with any kind of wild animal, bodily fluids, wastes in general. I think that's a good piece of advice. But do I think we're going to have a hantavirus outbreak here in New York City? Despite all the rats, no.
Okay. Good reality check, Dr. Céline Gounder. Thank you.
Well, at least 5 U.S. states are now monitoring passengers who were on that cruise ship in the center of the deadly hantavirus outbreak. And those passengers have since returned home, but 150 others are still on board as the ship makes its way towards Spain's Canary Islands. Joining me now is Dr. Monica Gandhi, professor of medicine and infectious diseases at UCSF. Dr. Gandhi, great to be with you. The World Health Organization was adamant this is not COVID. But I got to admit, a lot of us have a little PTSD because it's following a similar story. We've seen this movie before. It all started with the cruise ship. Explain why hantavirus is not COVID.
Okay, hantavirus is definitely not COVID. So essentially, COVID is very readily spread by respiratory droplets. It's a highly contagious infection. Hantavirus is what's called RNA virus that is really from usually exposure to rodents like rats. That can, by the way, hide out in a cruise ship, and there are droppings around. No one noticed it, urine, and that's usually the main risk of exposure is from rats. Now, what's happened in this particular cruise ship is it's true there were 3 passengers, unfortunately, who got hantavirus and have died as a result. There are 8 with a likely hantavirus, and they were from all over. 1 is in Switzerland. But importantly, you need very close human-to-human contact to get it from a human. Now, usually it's spread from rats, but there is a strain called the Andes strain that can be passed with close contact from human to human, and it does look like this particular hantavirus strain is the Andes strain.
Is there any concern, though, Dr. Gandhi, that this strain could evolve much like we saw with other viruses and become even more contagious, that maybe you don't have to have super close contact with an individual to pass it on? Is there some concern it could mutate?
Likely not. So the way that we think of respiratory viruses, influenza, of course, that caused the 1918 pandemic. Coronavirus, we've all become super familiar that that's what caused the SARS-CoV-2 or COVID outbreak. But hantavirus is actually a virus that causes pulmonary symptoms, but it often causes kidney symptoms. It gets into the bloodstream. And by getting into the bloodstream, unfortunately, it causes what's called hemorrhagic fever. It has a long incubation period. You can get very sick, fevers, chills, really severe pulmonary symptoms. That's likely what unfortunately led to the deaths in these 3 individuals, and shock. It's really different than coronavirus, which is mainly a respiratory infection. So we never seen an example of this kind of animal spread, rat virus, really from rats and rodents, going into some sort of epidemic or pandemic potential. And the main thing is that cruise ships need to clean their ships.
Okay. Well, interesting you say that, because passengers have been let off the ship, given that they believe this virus is potentially spreading between close contact. Does that concern you that these passengers were let off to go home?
Yes, that concerns me, because I've been thinking about kind of breakdown in public health lately, with TB outbreaks and with Legionella outbreaks. I don't think we're in the best place with our public health selves. And what I mean by that is hantavirus is such a serious infection that the minute this was understood that there's hantavirus on this ship, you really want to isolate the ship. You want to make sure that everyone is tested before they get off. You can test by antibodies, or you can even do a PCR test, sequence the blood before they get off the ship. Remember the Princess Cruise, what you just referred to with COVID. People did not get off that ship. There was massive isolation and quarantine if there was exposure. But the word quarantine comes from 40 days. A ship had to be waiting out in the Italy port before it could come in, because you need a long period to make sure people don't get sick. So yes, I think there should have been better contact tracing and not allowing people to kind of disperse. Now they're trying to track everyone down.
That's right. And the various health departments have basically said to these individuals, keep monitoring us, but call us when you start to have symptoms. So you said it's a long incubation period. Are you contagious during that whole time, or are you only contagious once you start having symptoms?
So that's a very good question. So the incubation period can be up to 20 days. And the first 10 days after you've been exposed, you can be contagious before you get symptoms and right after you get symptoms. So wow. You're right that you may not know. Now, again, though, the difference is it's close human to human contact. As long as someone's isolated from other people in the home, which everyone should do if they were on the cruise ship, they're not going to spread it in the air, spread it through the air conditioning, have it go all over the house. It's really close human to human contact. And it's also pretty hard to get from human to human. That's why it's not going to be the pandemic potential, but we got to track down everyone that was on this cruise ship. Absolutely, the minute they have symptoms, test them. And in an ideal world, they wouldn't have been allowed off the cruise ship unless we had tested all of them.
Do we have the capability, though, to really track individuals? Is this what we did when coronavirus first came out? I mean, all these different countries and states, they have different rules when it comes to access to medical information, right?
Yes. I mean, I think one tragedy that I have to mention now is that the U.S. withdrew from the World Health Organization the day this administration took office on January 20th, 2025. It is a complete tragedy because the WHO is very important for epidemic surveillance. They are the ones that put together all the data from different countries and tell us what's going on. The WHO is leading this response. So we should be in the WHO. I need to make that comment. And second is, in this particular case, everyone who was on that ship knows they were on that ship. Everyone has been contacted. They are going to be alerted and watched for symptoms. And I think we're going to be able to contain this out in the world, but it would have been better if we had contained it in the ship. And again, this is probably a breakdown that they should have not let people off the ship.
There's a lot of anxiety, though, now of not knowing who to believe, who to trust. If somebody is having that anxiety and maybe lives in one of these states, maybe knows somebody that was on that ship and they want to get the best information, are you saying the best way to get that is really from the WHO?
The WHO actually has a very good updated information about hantavirus, but to give credit, so does the CDC. And the CDC is also closely involved with the US-based people who are on the ship, because the CDC is our public health response. Now, the CDC can't follow everything they're supposed to be doing because they've also had cuts to them, but they are being very aggressive about the hantavirus case reporting and watching everyone who is on that ship. So I feel pretty comfortable that everyone's been alerted and that they are sitting not going around anyone, and ensuring that they don't get sick within the incubation period.
We know there's been so many cuts statewide, nationwide, to health organizations. I'm curious, though, were there lessons learned during COVID that makes those departments more equipped to handle a potential other epidemic or pandemic?
Yes. I mean, I think actually what we learned during COVID is we didn't have the test capability right away with COVID. And it took us a long time to get tests, and people couldn't get access to tests. And we were pretty much saying, like, everyone stay in their houses. This is different. We immediately, when this hantavirus cruise ship, because of its international potential, the tests are available. It's actually a very easy antibody. And if need be, if someone's sick, we can get a test from the CDC to look at PCR. So the tests are available. They could contact everyone on the ship. People are all sitting at home, they should be, and not going out until we can ensure that they don't have symptoms within the period and they're being informed about what to do. So I feel comfortable about this particular public health response, but everything that you just said is true. The massive cuts to public health in this country and worldwide is going to cause the anxiety about new pandemics, and we need to not cut public health. It's too important.
Dr. Gandhi, great to see you. Thanks so much.
Thank you.
Returning now to our top story, 5 U.S. states are tracking passengers returning from a cruise ship hit with a deadly outbreak of hantavirus. For more, let's bring in CBS News chief medical correspondent Dr. Jon LaPook. And doctor, another physician actually came up to you today and said, do we need to be worried about this? I mean, what did you say?
Yeah, just this morning. And, you know, this is somebody with a lot of knowledge. And so what it said to me is, you know, people are worried about this. And I think when they hear the World Health Organization today say, well, the risk to the general public is low, it's kind of triggering, because they're thinking, well, is this going to, you know, is this going to be another pandemic? Is this going to be just like COVID? And there's a big difference. What I told her was, no, you don't have to be worried in general about flying. Remember that with the pandemic, COVID was caused by a virus we had never seen before, right? And we didn't know anything about it. This is a virus that we've known for 30 years. We do know how it's spread when it is spread. It's generally, you know, you get it from rodents, from droppings, saliva, from urine, and you inhale it. However, occasionally, and really not that often, it can go from person to person, and it generally has to be pretty close contact.
Okay, so that's this Andes strain.
The Andes strain, right.
About, right?
Right.
And so
one of dozens of there are dozens of strains of hantavirus. There's only one that has been shown to go from person to person.
How do you define close contact?
You know what? The CDC, you really asked a good question. The CDC is going to be coming out with guidance about that, because when you think about a cruise ship, that's generally sort of like a little bit of, I don't want to call it a petri dish, but it's sort of a lab experiment for close contact, right? I know there's a whole business there. I'm not trying to like tear that down, but it is a place where people are generally interacting with each other. We know that the index case, you know, was a man who then probably infected his wife. You know, sadly, they both died. You're in close contact with people. The question is what is close contact? And generally, it has to be sexual contact or people who are very close with each other, and not generally sort of people across the room. We remember with COVID, we found out that if you're in a room, we initially said 5 feet. If you're in a room that's not well ventilated, the virus can sort of aerosolize and go across the room like cigarette smoke can. So if you're in a room with 20 feet away, somebody smoking, you can smell it. That is not felt to be the case here. But we always have to have an asterisk here. We're at the beginning of this. You have to have humility. We're going to always end by saying, this is what we know now. And if something changes, we're going to let people know.
Are there any cases not associated with the cruise ship?
Not right now, no.
Okay.
They're all associated with the cruise ship yes, associated directly. So there were people who were passengers on a plane where the person who was on the cruise who got sick subsequently, developed full-blown disease. And now the question is, were they close enough on the plane to get infected? So yes, it's not directly from the cruise ship. But I just should say for the general public, the risk right now is felt to be low. You had to have been part of that, in that bunch of people who were sort of either directly or indirectly related to what happened on the cruise ship. And it's a great example of why you have to have cooperation between, the World Health Organization, the CDC, our own state departments involved, local health departments are involved, because you're trying to interrupt the chain of transmission. And that means like a lot of boots on the ground, finding out, who went where, when did they go. You have a long incubation period of 6 weeks around. So that means somebody could have gotten infected on the ship and then left the ship, and now they're somewhere else. You don't know where they are, how long. Yeah. Within the next day, I'm told by a source that knows the things that's going on at the CDC, that within the next day, you're going to see public guidance on when somebody has been sort of a contact. Not that they have it, for sure, they're in contact. What should they do? So stay tuned for that.
We'll be looking out for that. Thank you, Dr. Jon LaPook. Appreciate your time.